According to the World Health Organization, 38 million Indians, or 4.5% of the population, suffers from anxiety disorders. I am Nicole Fernandez, counseling psychologist at TalktoAngel. Welcome to our channel series on clinical disorders, episode 2, Anxiety. Today we have Dr. R.K. Suri, who is a clinical psychologist and mentor at TalktoAngel, with us to talk about anxiety and how online counseling can help us. So the first question today is, what is anxiety and how is it different from stress and worry?
Thank you, Nicole. First of all, anxiety, worry, stress, they are on a continuum. We all feel anxious, we all feel worried, we all have experienced stress in our day-to-day life. Now, stress is a very important dimension in our day-to-day functioning. If we are not stressed or if we are not having a worry to do anything, we would not be daunting to complete the task. It is very normal to be anxious when you have an examination or a medical procedure or you're going forward for the first time for a date. It's absolutely normal. However, it becomes a disorder when it is impending fear or apprehension that something wrong is going to happen to you, and that is in the form of an excessive fear, and it is impacting your day-to-day functioning, and it is becoming overwhelming. So we can clearly, vividly express that to be anxious is not bad, to worry is also not bad, to have an adequate stress is good for health.
Thank you for telling us about what exactly is anxiety and how it is different from stress. Let's talk about the different types of anxiety.
Normally when we talk about anxiety types, there are 5 different types of anxiety which has been classified as anxiety disorder. Now, first of them is the most common, which is we call as 70 to 80% is generalized anxiety disorder, GAD. The other is the separation anxiety, social anxiety, phobia, and is a panic disorder. These are the major 5 types of anxiety disorder.
Now, when we talk about these disorders, with these different types of anxiety disorders, of course they come with different causes and symptoms as well. Could you please elaborate on that?
Well, as far as the generalized anxiety disorder is concerned, there are no major specific issues attached with the generalized anxiety disorder. That's why it is called as generalized. It could be related to health, it could be related to examination, it could be related to performance, and we are not able to define why that anxiety is coming, and that's why it is called a generalized anxiety disorder. The other types of disorders like social anxiety. Social anxiety happens predominantly when one is having a difficulty to perform at the stage or having a difficulty to meet people, and as a result the person becomes socially withdrawn. But we need to differentiate the socially withdrawn as a characteristics, not a part of the psychotic illness, where it happens in the schizophrenia also. But that is a social withdrawal. But when we talk about social anxiety, the person is having a difficulty to face the people in the social settings. And it is a form of anxiety which can easily be managed and treated. The other is a separation anxiety. The separation anxiety normally happens with children or happens with adults or particularly the old age people. They have a separation and of their children's going away, or mothers having a separation anxiety that their kids are now going to college, how they are going to perform, how they are going to stay. The other is a phobia. Phobia is a specific fear of a specific thing when it goes beyond one's ability to handle and is impacting them on a day-to-day functionality. The last but not the least is a panic disorder. Panic disorder may last from 2 minutes to 1 hour. It may happen once in a week, maybe once in a month, or once in 1 year, or once in lifetime. In the panic disorder, the person is having a extreme anxiety, palpitation, and not able to stand properly, as if the heart is getting sunken, feeling extremely jittery, is not able to understand what is happening, and as a result tends to enter into land up into emergency setup of the hospital, and after due investigation it comes out to be that the person is not having any organic illness or any heart disease, but the person feels that he or she is not able to survive, and that is a panic button which needs to be addressed very meaningfully.
Thank you, sir, for giving us such a detailed overview and important distinctions between the different types of anxiety disorders. According to your knowledge and your expertise, what are the various treatment options that are available for anxiety disorders?
Thank you, Nicole. The treatment or management of anxiety varies from person to person. There are different methods of managing the anxiety and treatment of anxiety. The most common practice is self-care, which invariably every human being tries to do at their very first instance. As and when he or she is not able to handle at his own or with the help of his family member, friends, he or she reaches out to an expert. When he or she reaches out to an expert, it is very, very important that we must classify the type of anxiety. We must also classify the severity index of anxiety. Now, to do this, we have various psychometric tools to assess the anxiety. After the anxiety is defined, assessed, if it is in the range of moderate to severe anxiety or profound anxiety, then the treatment modality which we normally recommend, A, is the therapy, psychotherapy, in the form of cognitive behavioral therapy, in the form of relaxation therapy, in the form of mindfulness practice, in the form of DBT, dialectic behavioral therapy, or the hypnotherapy. Now these all comes under the therapeutic modes, psychotherapeutic modes. Recommended to have a consultation with general physician or a psychiatrist for detailed psychiatric evaluation and take a medication. Normally the psychiatrist recommends medication for anxiety. At this TalktoAngel, we have best psychiatrists for consultation for the medical management of anxiety. Consult the best clinical psychologist or counseling psychologist at TalktoAngel, or they can seek a medical intervention by the psychiatrist at the platform.
Thank you so much, sir, for this insightful session on anxiety disorders and how to overcome it. Looking forward to connect with you on our next episode.